You may think stroke is only a disease of the very old, something that happens in nursing homes or late in life when the body has already given up. But the truth revealed by the Centers for Disease Control and Prevention is far more alarming. In the United States, deaths from stroke among people in middle age have surged to the highest levels in 2 decades, with nearly 20,000 lives lost in a single year. That is not an illness of the elderly. That is a silent epidemic striking people who are still working, raising families, and planning their futures. The risk of stroke doubles every 10 years after the age of 55. And, for women, the odds are even harsher. 1 in 5 between 55 and 77 will experience a stroke, and many will not survive. During the COVID pandemic, these numbers spiked even higher, showing how fragile our circulation and brain health really are when infection, stress, and chronic disease all collide. The worst part is that most victims ignored the early signs or believed they were too young, too healthy, or too busy to be in danger. They mistook sudden dizziness for fatigue, blurred vision for eye strain, or slurred words for simple tiredness. Minutes later, their lives were changed forever. In this video, I will show you 7 hidden dangers that are quietly pushing stroke risk higher than ever. Even in people under 65, some of them are lifestyle habits, some are medical conditions, and some are choices you can change starting today. Understanding these risks could mean the difference between independence and disability, between life and death. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. The rising numbers. Nobody expected. For decades, doctors were encouraged by the steady decline in stroke deaths across the United States. Public health campaigns worked. Blood pressure medications improved, and people were surviving longer. But something disturbing began to happen around the year 2012. Instead of continuing to fall, the death rate from stroke in people between the ages of 45 and 64 began to climb again. At first it was slow, a few percentage points that could be dismissed as statistical noise. But as the years passed, the trend became undeniable. By 2019, before the pandemic had even begun, deaths in this age group had already risen by about 7% compared with just 7 years earlier. And when COVID swept across the world, the numbers spiked dramatically, rising another 12% in only a short time. By 2022, more than 19,700 Americans between the ages of 45 and 64 had died of stroke. That is the highest toll in 2 decades. To put it in perspective, that equals about 24 deaths for every 100,000 people in this age group. Think about that number. These are people in the prime of their lives, not the very elderly, not frail nursing home residents, but middle-aged adults who were supposed to be working, caring for families, and enjoying the fruits of life experience. The rise in deaths was not evenly distributed. Some groups, particularly Black men in the South, carried a burden far heavier than others, with death rates nearly 3 times the national average. This is not just a medical story. It is a social story about stress, lifestyle, inequities in access to care, and the lingering effects of a virus that damaged blood vessels long after the infection ended. And the tragedy is that many of these deaths could have been prevented if warning signs had been recognized and risk factors addressed earlier. One woman, only 52, dismissed her sudden vision problems as fatigue from working late. By the time she went to the hospital, it was too late to reverse the damage. Her story is repeated thousands of times across the country. Proof that stroke does not wait for old age. If this reality shocks you, it should. And if it surprises you, wait until you hear what comes next. Because the real danger is not just the numbers rising. It is the way middle age itself has become the new danger zone for stroke. Part 2. Why middle age is now the danger zone. Many people still believe stroke is an illness of the very old. Something that appears in the final decade of life, when frailty has already set in. But the data now prove otherwise. Middle age, the years between 45 and 64, has become one of the riskiest times for stroke. And the reasons are both biological and social. Biologically, the arteries that carry blood to the brain begin to harden earlier than most realize. By the time someone reaches 50, small cracks and fatty deposits have already begun to form along the vessel walls. These deposits, called plaques, narrow the arteries and increase the chance of a blood clot getting stuck. Once a vessel is blocked, brain cells downstream are starved of oxygen, and within minutes they begin to die. This is the hallmark of an ischemic stroke, the most common form. At the same time, high blood pressure, which affects nearly half of American adults, exerts relentless force on the delicate blood vessels of the brain. Over years, that pressure weakens them, making them prone to rupture and causing a hemorrhagic stroke. For people in middle age, this 1-2 punch of narrowing arteries and rising blood pressure creates the perfect storm. But biology alone does not explain the sudden increase in stroke deaths among middle-aged adults. Lifestyle plays a powerful role. Many people in this age group are juggling stressful jobs, caring for children or elderly parents, and neglecting their own health. Exercise declines. Diets become heavier in processed food. Alcohol intake rises. And sleep becomes irregular. Each of these factors adds weight to the burden carried by already stressed arteries. Add to that the high rates of obesity and diabetes, both of which are increasingly common in middle age. And the danger multiplies. A man in his early 50s may feel perfectly healthy while ignoring borderline high blood pressure and slightly elevated blood sugar. But inside, his vessels are primed for a crisis. Then comes an infection like COVID, which inflames the blood vessels even further, making clots more likely. The result is a sudden collapse that seems to come out of nowhere, leaving families shocked that someone so young could suffer a stroke. One patient, a 49-year-old teacher, collapsed in her classroom after weeks of dismissing headaches and fatigue. Her colleagues thought she was simply stressed, but she had suffered an ischemic stroke that required emergency treatment. Her case is a vivid reminder that stroke is not just for the elderly. It is creeping into the years once thought safe, transforming middle age into a danger zone where vigilance is more critical than ever. And if you think infection like COVID was just a passing storm, wait until you see how its impact continues to shape stroke risk years later. Part 3. COVID-19 and its lingering impact. When the COVID-19 pandemic first struck, most of the attention was on the lungs. Doctors warned about pneumonia, ventilators, and respiratory failure. But as the months went by, another troubling pattern began to appear. Patients of all ages, Even those in their 40s and 50s were arriving at hospitals not just struggling to breathe, but suddenly unable to move one side of their body, unable to speak, or blinded in one eye. They were having strokes, and in many cases the infection was the trigger. Research soon confirmed what frontline doctors suspected. COVID does not only attack the lungs, it inflames the lining of blood vessels throughout the body, including those that feed the brain. This inflammation makes the blood more likely to clot, is a dangerous combination that sets the stage for ischemic stroke. In some patients, clots formed in the heart or legs and then traveled to the brain, causing sudden blockages. In others, fragile vessels weakened by years of high blood pressure or diabetes began to leak or burst under the strain of infection, leading to hemorrhagic strokes. What shocked many neurologists was not only how common these cases were, but how young the patients could be. Middle-aged adults with no previous history of vascular disease suddenly collapsed at home or at work. Some recovered, but many were left with lasting disabilities. For those already carrying risk factors like obesity, diabetes, or hypertension, the infection acted like a spark on dry wood. Even after recovering from the acute illness, some people continued to face elevated risks for months. The virus left behind a trail of inflammation and damage to blood vessels that did not simply vanish when the fever broke. This lingering effect explains why stroke deaths spiked during the pandemic and remained higher than before even after vaccines and treatments became widely available. One man, only 51, survived a relatively mild COVID infection and thought he was fine. 3 weeks later, he developed sudden slurred speech and weakness in his arm while playing with his children. Doctors discovered a clot in his brain. He survived, but his life was forever changed. His story is one of many, proving that COVID was not only a respiratory threat but also a vascular one. The lesson is sobering. Viruses can leave scars that the eye cannot see. And for people in middle age already carrying silent risks, those scars may erupt into life-threatening events like stroke. This is why experts now insist that monitoring blood pressure, cholesterol, and blood sugar is more important than ever after an infection. The pandemic revealed a hidden vulnerability, and ignoring it could set the stage for more preventable deaths. If you thought COVID was over, think again. Its shadow lingers in the rising stroke statistics. A reminder that the health crisis is not behind us but woven into our future. And if infection alone was not enough, consider how race, geography, and inequality have made the burden of stroke even heavier for some groups than others. Part 4. Racial and regional disparities. One of the most alarming truths revealed by recent data is that not all Americans face the same risk of stroke. Race, ethnicity, and geography create invisible but powerful fault lines that determine who is most likely to suffer and die. Among seniors, Black adults already face a higher risk of stroke than white adults. But in middle age, between 45 and 64, the difference becomes staggering. The stroke death rate for Black adults in this age group is more than double, reaching levels that look like another epidemic hiding within the larger one. To put it plainly, being a middle-aged Black man living in the South carries one of the highest stroke risks in the country, nearly 3 times the average rate. These are not abstract numbers. They represent fathers, mothers, teachers, and workers struck down in the prime of their lives, leaving families and communities devastated. Geography deepens the divide. Stroke deaths are consistently higher in the South, often called the stroke belt. diets high in fried foods, higher rates of obesity and hypertension, limited access to preventive health care, and persistent poverty all create conditions where strokes thrive. In rural areas, hospitals may be far away, and emergency care is delayed. Minutes lost in travel can mean brain cells lost forever. For middle-aged adults, especially those juggling jobs, family responsibilities, and limited resources, the odds are stacked against them. The disparities are not only medical but structural. Decades of unequal access to healthy food, safe neighborhoods, affordable housing, and consistent medical care have left deep scars. Stress from systemic racism, economic hardship, and lack of trust in healthcare systems adds another layer of risk, pushing blood pressure higher and weakening resilience. The result is a vicious cycle where the most vulnerable populations carry the heaviest burden. I recall the case of a 55-year-old woman in Mississippi who delayed seeking help for sudden dizziness and slurred speech. By the time she reached the nearest hospital, over an hour away, her stroke had progressed too far for clot-busting treatment. Her story reflects the cruel intersection of distance, poverty, and unequal care. Breaking these disparities requires more than urging people to eat better or exercise more. It requires addressing the root causes, from expanding healthcare access to ensuring early detection and aggressive management of hypertension and diabetes. It requires community-level education so that every family knows the FAST test and acts without delay. Stroke is not an equal opportunity killer. It strikes hardest where inequality runs deepest. Recognizing this is not about despair, but about urgency. We cannot change the biology of aging, but we can change the systems that determine who gets care and who gets left behind. And once we understand how unequal the battlefield is, we can look at the weapons we already have, from modern treatments to rehabilitation, that can help people not only survive a stroke but reclaim their independence. Part 5. Gender differences and hidden risks for women. When most people picture a stroke patient, they often imagine an older man clutching his chest or collapsing suddenly. But statistics tell a different story. Women not only live longer than men, they also face unique risks that make them more likely to die from a stroke and more likely to suffer lasting disability afterward. In the United States, 1 in 5 women between the ages of 55 and 77 is predisposed to experience a stroke. The reasons go beyond simple biology. Women are more likely to develop strokes later in life when they already face other medical conditions such as osteoporosis, atrial fibrillation, or dementia. They are also more likely to live alone in their older years, which delays recognition of symptoms and urgent care. This hidden loneliness becomes a silent risk factor because when no one is there to notice a slurred word or a drooping face, precious minutes are lost. Hormones add another layer. Estrogen, once protective in younger years, declines sharply after menopause. Some women use hormone replacement therapy or take birth control pills that contain estrogen. Both can increase clotting risk, especially when combined with smoking, high blood pressure, or obesity. This is why even middle-aged women, not just seniors, must take stroke prevention seriously. Pregnancy-related complications are another overlooked factor. Preeclampsia and gestational diabetes increase the lifetime risk of stroke. A woman in her 30s who develops high blood pressure during pregnancy may not think about stroke decades later, but her vessels remember. These hidden risks accumulate quietly, waiting for the vulnerable years of older age to strike. Symptoms in women can also be more subtle and easily dismissed. Instead of the classic facial droop or arm weakness, some women present with sudden fatigue, nausea, shortness of breath, or even hiccups. These atypical signs lead families and even doctors to misinterpret the event as indigestion, stress, or anxiety. By the time the true cause is recognized, treatment windows may have closed. I remember the case of a 60-year-old woman who woke with dizziness and trouble speaking. Her family thought she was exhausted from caregiving duties. Hours later, she collapsed and was rushed to the hospital. But the clot-busting medication could no longer be used. She survived, but with permanent speech difficulties. Her story is a painful reminder that ignoring unusual symptoms in women is costly. The good news is that awareness saves lives. Families and caregivers must learn that women's strokes may look different and act fast regardless. Women themselves must advocate for their health, controlling blood pressure, cholesterol, and avoiding smoking or excessive alcohol. Doctors now stress the importance of tailoring prevention strategies for women, recognizing the role of hormones, pregnancy history, and social circumstances. Stroke does not discriminate, but its impact is not the same across genders. For women, the risks are layered, the symptoms sometimes masked, and the consequences often more severe. And as we uncover these hidden dangers, the question becomes clear: what treatments are available? And how can emergency response make the difference between full recovery and lifelong disability? That is where we turn next. Part 6. Prevention is still possible. You are not powerless. Even if the headline sounds scary, stroke risk rises with age. But the choices you make this month, this week, and even today can shift the odds in your favor. Prevention begins with knowing your numbers. Check blood pressure at home with a validated cuff. Aim for steady readings in the healthy range as advised by your clinician. And bring a written log to each visit. Ask for a simple finger poke or lab panel to track cholesterol and blood sugar. When you know where you stand, you can act early rather than react late. Lifestyle is medicine, especially in middle age. Build an eating pattern that protects your arteries. Think vegetables, fruits, legumes, nuts, seeds, fish, olive oil, and whole grains, while trimming added sugars, refined starches, trans fats, and excess salt. A simple plate rule helps. Fill half with colorful produce, 1/4 with lean protein such as fish, beans, or skinless poultry, and 1/4 with intact grains. Choose water, tea, or coffee without added sugars. And if you drink alcohol, keep it modest or skip it. Movement is your daily prescription. Aim for at least 150 minutes of moderate activity each week, such as brisk walking, cycling, or swimming, plus 2 sessions that strengthen major muscle groups. If that sounds like a lot, begin with 10 minutes a day and add 5 minutes each week. Consistency is the goal, not perfection. Even short bouts collected across a day lower blood pressure, improve insulin sensitivity, and reduce inflammation that primes the brain for stroke. Sleep and stress matter more than most people realize. Treat loud snoring, witnessed pauses in breathing, or unrefreshing sleep as red flags for sleep apnea. A powerful driver of high blood pressure and atrial fibrillation. Practice a simple breathing routine, such as slow inhales through the nose and longer exhales through pursed lips for 5 minutes. to settle the nervous system and keep stress hormones in check. Choose a wind-down routine each night. Dim lights, no late heavy meals, and a regular bedtime. Medical prevention is powerful when tailored to you. Work with your clinician on a plan that may include statins for high cholesterol, blood pressure medicines that protect the brain and kidneys, and glucose-lowering therapies. If you have diabetes, ask whether a heart rhythm check is appropriate, since silent atrial fibrillation can send clots to the brain. Learn when blood thinners or antiplatelets are indicated. And do not start aspirin on your own. The right choice depends on your personal risk. If you had COVID or live with multiple risk factors, schedule a review to revisit targets, adjust medicines, and update vaccines that reduce severe illness and the inflammatory swings that stress your vessels. Build a safety net at home and at work. Post the fast reminder on the fridge. Teach family and coworkers to spot a drooping face, a weak arm, and slurred speech, and to call emergency services immediately. Save your hospital preference and medication list in your phone. Keep shoes by the bed. Leave a porch light on. And make sure your house number is visible so first responders find you fast. Finally, track progress, not perfection. Celebrate small wins. A week of home blood pressure checks, 3 vegetable-filled dinners, an extra walk at lunch, a coffee without sugar, an earlier bedtime. Each choice nudges your arteries toward health. Prevention is not one giant decision. It is a series of small, repeatable steps that protect your brain, your independence, and your future. Doctor's final words. Looking at the numbers, it is easy to feel overwhelmed. Stroke has climbed to the 5th leading cause of death in America, and the recent rise among middle-aged adults paints a picture that is both sobering and urgent. But as a doctor who has walked beside patients in the emergency room, in rehabilitation, and at their kitchen tables, I want you to remember one truth. Stroke is not only about tragedy, it is about opportunity. Every risk factor we have discussed, from high blood pressure to diabetes, from obesity to smoking, is modifiable. That means you can change the trajectory of your health starting today. I have seen people in their 40s, 50s, and 60s take control of their habits, stabilize their blood pressure, clean up their diet, add daily walking, and extend not only their lifespan but the quality of their years. The human brain, even after injury, has an incredible capacity to heal and rewire. But prevention is always more powerful than repair. Women especially must heed this call because they live longer. They face more years at risk because their symptoms are often atypical. They face delays in recognition, and because many live alone, they face longer waits for urgent care. For them, awareness is medicine. Knowing that sudden fatigue, dizziness, or confusion could signal stroke may save their lives when minutes matter. For men, the risk may come earlier, striking in middle age when careers and families demand the most energy. Ignoring warning signs out of pride or denial can turn a preventable condition into a lifelong disability. Pride cannot protect your brain, but a phone call to emergency services can. This is my plea to you. Do not dismiss stroke as an old person's disease. Do not ignore a sudden headache, a weak arm, or slurred speech. Do not wait for symptoms to pass. Call immediately, because every second is brain tissue, Share the FAST method with your family, your coworkers, your community. Teach them that a drooping face, a drifting arm, or garbled speech means time to act. These are not just medical facts. They are survival tools. Prevention is still possible. Resilience is still within reach. Your body still remembers how to heal if you give it the chance. Choose wisely what you eat, how you move, and how you rest. Respect your numbers. Respect the signals your body gives you. And above all, respect the minutes, because they can mean the difference between walking out of the hospital and never walking again. Share this message with someone you love. You might just save their life. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Do not forget to like, share, and subscribe to our channel for more content like this. Thank you for watching. And here is to living life on your own terms.